Good afternoon, everyone. Myself, Dr. Sugandha Agarwal, Department of Public Health Dentistry, Babu Banasidas College of Dental Sciences. Will be taking a lecture on Community Periodontal Index of Treatment Needs, that is CPITN index. So, starting with the development of CPITN, WHO, its World Health Organization, organized workshop inviting experts from 14 countries at Moscow in 1977 to examine and advise on the epidemiology, etiology, and prevention of periodontal disease. To develop CPITN, the criteria was published in 1978. Later, minor modifications were made in 1982 and has been used more than 20 years. The original CPITN divided the mouth into 6 sextants, that is, teeth numbers 17 to 14, 13 to 23, 24 to 27, 37 to 34, 33 to 43, 44 to 47. The clinical findings and observation into 5 code was 0 to 4. The periodontal treatment need indicators into 4 different treatment need categories, that is 0 to 3. Treatment need is assessed using specially designed WHO color-coded periodontal probe for assessment of probing pocket depths around either all teeth or all the WHO designated index teeth. For each sextant, only the highest treatment need indicator is recorded. Probing force is between 0 to 20 grams. A sextant is examined only if there are 2 or more functional teeth present are not indicated for extraction. Identified after examining all the teeth. When only one teeth remains in a sextant, it is included in the adjacent sextant. Index teeth. These teeth have been identified as the best estimator of the worst periodontal condition of the mouth. For adults aged 20 years or more, only 10 index teeth are examined. For young people up to 19 years, only 6 index teeth are examined. When examining children less than 15 years, pockets are not recorded. Scoring criteria. Code X, when only one tooth or no functional teeth are present in a sextant. Code 0 is a healthy tissue. Code 1 is bleeding observed during or after probing. Code 2 is supra or subgingival calculus or plaque retentive area seen or felt during the probing. Pathological pocket of 4 or 7 mm, that is the black area of CPITN probe is at the gingival margin. This is the black area, black band of CPITN probe. Pathological pocket of 6 mm or more, that is the black area of the CPITN probe is not visible. Treatment needs. 0, code 0 or X is no treatment required. Code 1 is improving the personal oral hygiene of that individual. Code 2 or 3 need for professional cleaning, root planning, and removal of plaque retentive factors in addition to oral hygiene instructions. Code 4 is complex treatment which involves deep scaling, root planning, and more complex surgical procedures. Advantages when compared to other epidemiological indices for periodontal health. The CPITN is simple and more objective in its choice of clinical criteria and methodology. The data offers rapid appreciation of the periodontal condition of a population and their treatment needs and personal requirement. International uniformity treatment need provides an indication of the level of complexity of care needed if the periodontal condition are to improve. Limitation does not provide assessment of past periodontal disease experience. Do not record the position of gingival margin, that is a degree of recession, level of alveolar bone. Exclusion of important signs of past periodontal breakdown, notable attachment loss, tooth mobility, and absence of any marker of the disease activity or susceptibility. No difference between the supra and subgingival calculus. No distinction is made between the presence of calculus or with or without bleeding. Validity of CPITN index as a measure of the amount of periodontal care needed has not been demonstrated. Now, the Community Periodontal Index, that is CPI, introduced in 1994 by the World Health Organization. In this, the score 0 is the loss of attachment is 0 to 3 mm. In the CAG, that is cement to enamel junction, not visible at, and CPI score is 0 to 3 mm. Score 1, loss of attachment 4 to 5 mm in the CAG within the black band. Score 2, loss of attachment 6 to 8 mm CAG between the upper limit of the black band and 8 to 8.5 mm. Score 3, loss of attachment 9 to 11 mm CAG between the 8.5 mm and 11.5 mm. Score 4, loss of attachment, that is 12 mm or more CAG beyond the 11.5 mm. X is the excluded sextant. 9 is not recorded as a CAG, neither visible nor detectable. Advantages: comprehensive measures of periodontal disease, severity of disease can be measured, and treatment needs can be recorded. Disadvantage, time consuming, calibration will be difficult, involves many criteria. Thank you. That's all for this CPITN lecture.